Hello, you amazing and miraculous people. Oftentimes when I'm showing patients their x-rays, I'll point out the fact that they're having bone spur formation occurring in their spine. And some of them are not surprised at all. Yep, got old arthritis in there, good old Arthur. And others are like shocked. They had no clue that they're developing bone spurs. So I thought I would share scientifically how bone spurs actually form. We're going to go back to watch batteries. So in a digital watch, I haven't worn a watch in a long time, but if I had one, in a digital watch you have a watch battery, and that watch battery has a little crystal in it, and they can bend the crystal to a certain degree, and that gives forth a certain current, and that current is used to make the battery, and that battery can then have click, 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 and tick-tock that watch. 1 second, 2 seconds, 1 minute, 1 hour, and it's precise because there's a certain bend and stress on that crystalline structure, that little crystal wafer, that gives off a certain current. Now our bones are crystalline. They are made of calcium and all types of other minerals. And when you put a stress on a mineral, it's going to change its electrical charge. Well, we have in the front of the spine, we have a big ligament that runs up and down all along the anterior. In fact, all your bones are held together with ligaments. So if we take, for example, the neck bones, the cervical vertebra, and we change the position, put stress on the discs between the bones, push that forward, stretch that ligament pulls on its attachment points on the bone, changes the electrical charge, creates a negative charge. Nature is going to neutralize that negative charge with positive ions. Now calcium and other bone matrix materials are positive ions, so it creates that positive charge and it builds a little tiny bit of calcium deposit, and then a little more, and then a little more, until we can see it on x-ray as a bone spur. And we've got some patients, they're so severe, they just look like big claws, and sometimes they fuse together. So the amount of subluxation degeneration, or the phase, is dependent upon how severe the problem is and how long it's been there, which is why we're always trying to correct the underlying causes. And when people come in to see us, oftentimes they come in based on symptoms. And the last component to show up when you're having problems is a symptom. The first component to go away is a symptom. And we think, I have no symptoms, I must be healthy. And then they're shocked to see that they have severe degenerative changes in their spine. That's why it's important, once discovered, to go through that corrective phase of care. And that takes time and repetition over several months typically. And most people are going to be out of pain in days to weeks. And if you don't follow through, you're only going to allow that condition to worsen. So that's how bone spurs are formed, the piezoelectric effect, and a little science nerdy stuff for you. But it's important to maintain a healthy spine, because your spine houses your nervous system. Your nervous system is the master computer of the body. If there's stress and strain to your nervous system, you are going to have dysfunction, dis-ease, and you're not going to experience and express the level of health that you deserve. This is the Wellness Doctor, Dr. Jeffrey Clark, with light, with life, with love. We appreciate you. Have a great day.